Welcome to My Line of Work. Here we dive deep into the world of work, what people do, why they do it, and how they got there. From dream jobs to unexpected paths, every story matters and every career has a story worth sharing. Our special guest today is RHIA Grant.
Hello.
Thank you so much for joining us. Go ahead and tell everybody what you do.
So I work administratively as a nurse. I have a LPN certification with my licensure, and I currently work remotely at a federally qualified health center. My health center is in Pennsylvania, and obviously I live here in Texas, so I work remotely. We moved here 3 years ago, and they kept me on. So awesome. I have a nursing background, but majority of what I do is administrative work, reporting, and supervisory type.
Interesting. Okay. And so what is your study in? You said LPN?
Yeah. So I went to school in Canada.
Okay.
Got my LPN certification.
Yeah.
Which is in Canada, it's a licensed practical nurse.
Okay.
And then here it's no, so that's not true. Let me back up. In Canada, it's RPN.
RPN.
Registered practical nurse.
Okay.
Yeah, but here it's LPN. I don't know what the difference is. There actually are some differences. So in Canada, there's not a lot of focus on pediatric aspects of nursing. And I think that's the difference between here and Canada. So I got my license there, and I worked for about, I think it was like a year and a half. And then before I got married and moved here, and then didn't work for a few years. But it's different when you're, overseas nurse to transfer all your stuff here so you can get licensed in the state that you work.
Okay.
So when I was ready to work, I lived in New Jersey, and New Jersey is one of the hardest states to transfer. To transfer your license as a international nurse, I guess, whatever it is. But what you could do, so New York allowed you to live in a different state, get your license, and then that state would allow you to transfer. So that's what I had to end up doing.
Okay.
Yeah, it was just like.
So you're no longer considered international.
No.
Now you're coming from another state.
Correct.
Okay.
Yeah. So then we moved to PA, and then I was able to do that, and then I got my license in PA, which I worked. And then moving here to Texas, I don't have like a Texas license, but I work remotely for a company in PA, so I'm still whatever. So yeah.
So in your field, it's the licensing is by state.
It's by state, correct. Okay. And I suppose in Canada, there's 13 provinces, so I think it's the same way. If I got my license in Ontario, if I were to go to, say, Nova Scotia or something, I'd have to do whatever that province required. So I think it's the same with the states here.
Very cool.
Yeah.
Okay. And how long is that? Do you know how long that is to get that license?
So when I went to school in Canada, I graduated in 1999. Yeah. Licensing, going through the RPN program was a year, like full year. Yeah. Like year, January to December. And then I graduated the next year after that. I'm not sure what it is now, especially here in the US. I think it might be similar. Yeah. If you just want your certification, or if you want an associate, it's 2 years. Okay. Or if you do the RN program, your BSN's 4. Okay. Yeah.
Very cool. And then, have you worked in a hospital?
So, let's see. So when I was going through school, I did like the practical part of the nursing. The training was in hospital med surg unit. That was the extent of my hospital. Like exposure was during my training. Once I became an LPN, I worked in geriatric nursing, like skilled nursing, that type thing.
Yeah.
And I also worked with an agency. And then when I moved to the US, living in New Jersey, I was it's so funny. I was doing bedside nursing and all the things, supervising. When I moved to the US and we were living in New Jersey, I was working in skilled nursing again, supervising the LPNs and the CNAs, I think they call them, whatever. And then in New Jersey, I worked with an agency. It was a home care agency, and it was actually not for nursing. I was like the administrator, the office manager type thing. So I kind of then that my kind of administrative management side of healthcare started. So yeah, then I moved to PA and went back to skilled nursing for a little bit. And then once I had my son, actually I had my son in New Jersey. So I left a office management job because I was a stay-at-home mom. Then we moved to PA, and then I had our second child, and I started doing like some kind of nighttime work so I could be home with them in the day, and then I went to work at night. So I was doing skilled nursing then. And then once my daughter our daughter turned, I think she was 6 months old, then I went the route of looking for like a 9-to-5 type job. And found the job I'm currently working in now, 13 years later.
It seems like you can do a lot with that.
Yeah.
with that.
And, yeah. My story
with that certification
is very not cookie cutter. It's and what I really like about what I do and my job in the health center in particular, I've worn many hats. And I don't think it's really because of my licensure. Like, I just think it's because the health center world just pulls you in different directions. If you can do it, you'll figure out a way. But it helps if you have that license, that background, because then they trust you more or whatever. So,
like get your foot in the door.
Get your foot in the door.
It opens opportunities.
Yeah.
Very cool. And so what made you pick nursing, or was that something you always wanted to do? Is it?
No.
Was it an unexpected path?
I was one of those kids that didn't really have a career path. I did not. Certainly my parents, my mom, I was living with my mom. She really never said like, what do you want to do or whatever. You just kind of went through school, and then you graduated high school, and then you're like, what am I going to do? I was one of those kids. So graduated high school, and it was time to like figure out your what's your post-secondary. What are you doing? In Canada, I applied to community college and went. I think my major was like psychology or something, because that's always the fallback. But the kids that know what they want to do, just do psychology. So started in the fall and went through that first semester, and I was like, this is not gonna work. What else is there, right? Healthcare is the next fallback. You just fall back. So I just fell into healthcare and did my LPN. My mom was already in healthcare. That didn't really appeal to me either, but I don't know. I just wanted something to do. I thought I was caring. I liked people, helping people. So I'm like, I'll do that.
There you go.
Yeah. And then, so I don't think nursing was like my thing. Like I wanted to do. No, it was not. It was not a career thing for me. But after all the time I've spent now and seeing how healthcare is very versatile, it's not like you have to do patient care. There's so much involved in healthcare. There's so many aspects of it. And healthcare is not going away. You'll always have people that need to, be taken care of and different things. So
more so now with the the way people eat and the a lot of sitting.
Yes.
So you say you work from home.
I do.
How long have you been working from home?
So, we moved here December 2021. So that was 3 years ago.
Were you
Over
working
3
remote
years.
in Pennsylvania?
So with the pandemic, when things shut down 2020, we did transition home.
Okay.
But then the summer of 2021, we opened up again. And I was going back to the office like a few days a week. Actually, I was back in the office full time. Yeah. And at that time, I was the clinical director at our center.
Okay.
So I was in the office, trying to navigate and, during COVID with all the vaccines and, all the things, trying to get that all organized.
Yeah.
Working with the care managers and all that. So I was in the office full time. And then in December, when I broke the news that we were moving, my supervisor, who was the chief medical officer at the time, I told her, and she's like, I didn't keep you. You were remote like not too long ago, so we'll work it out.
That's awesome.
Yeah, so she was like, just create your job description.
Yeah.
Just write some stuff down.
Wow, that's great.
So I wrote some stuff down, and the CEO was like, yeah, of course I'm going to keep you. So that's how that worked out. So yeah, I've been doing that for 3 years now, remote. And I like it. It's got its pros and cons.
Okay.
But I'm very much like a people person. I like to be, in the weeds.
Yeah.
I enjoy being around people and like problem solving and doing all the things. Working remote, I can't be, in certain, I guess, positions that I would if I were on site.
Okay.
Yeah. So remote work, what I do now, I guess we talk about that. So when I moved here, my role at that time, I just crafted a role. I think I was the clinical administrator. I just shifted from clinical director to clinical administrator.
Okay.
And just really managed care coordination and some different things like that. And
what is care coordination?
Care coordination. So care coordination, really supporting the patient's community, like providing community resources. So I manage a team that helps patients, identify resources that they need. So our health center is pretty comprehensive. We call it a medical home. And in our medical home, we have everything. We have medical, dental, vision, podiatry, OBGYN, and medication-assisted treatment program for those dealing with substance use disorders and behavioral health. So it's pretty broad. We want to be like that medical house where you go in and get everything you need. But there are some things that we don't have, like specialists. So a patient will need, to see a gastroenterologist for whatever digestive issues. So our team will work with that patient. Once they see the provider, gives them the referral. You need to see whatever. So we'll coordinate with that patient and the office to get the patient scheduled and any kind of roadblocks or barriers that they'll have. We have the resources and stuff to kind of navigate that for them. So that's what care coordination does. So that's one way. And then durable medical equipment like DMEs for patients, they might need supplies or tools to manage their chronic conditions, those type of things. So my team will get them where they really go to help them to navigate the outside space. Yeah. So that's care coordination.
So are you on the phone a lot? Are you on the computer? What are you? What does that look like?
Right. So I'm on the computer.
Okay.
And the phone, because I could help with triage too. Like if a patient calls and needs, has symptoms or something, and I can help that. I can answer those calls. I'm also on the phone, the other offices, doctors' offices, pharmacies, anybody that calls that needs help or I'm on the phone and I deal with that too. I'm also over the medical records department. So our medical records team that they take in all of the records and the documents and, gets them to where they need to go and the fax, like all of that. So I manage all of that too. And so, I could be on the phone, but most of my day to day is really involved in answering questions, navigating, managing the team. And I'm in meetings all the time because my third role is, and I guess the current title I hold is data management director.
Okay.
So I'm over our systems, the EHR, the electronic health record, our practice management system that does the billing and the scheduling and all that. So that whole system.
Yeah.
I'm the director, the lead for that. So yeah. So we have those meetings and if there's upgrades, if something's broken, I manage the ticket system with our IT department. I train the staff too from that perspective. Our providers, any new hires that are onboarding, make sure they get the training they need. And then I sit with them one-on-one and, show them the system and what they'll be doing and answer all those questions, get them set up and stuff. So yeah.
Do a lot.
Yeah, I do. But it's so exciting. And I'm so grateful because I think working in a place like I've been, I've really been exposed to a lot of different things, which I didn't even realize. Because when I came into the health center world, doing bedside nursing, medicine, chronic diseases and how to help that way. But I didn't know even vaccines, all the vaccines, the childhood vaccines and all this side of healthcare, the provider practitioner side of it. So that's what I came in and I learned that. And then, then I was population health because that's a big part of the health center world too. The, kind of bucketing our population. How many women do we have in this age? What do they need? How many kids, all that. Men over whatever, you need to have your whatever's done. So all those things. At one point I was doing all that, but then our health center, we hired a lot of people. And so now there's different departments that manage those kinds of things. But with all that said, I'm very grateful because I have had the experiences that now I can kind of choose. Oh, I liked this thing that I was doing. Yeah. And I think I want to pursue that.
Oh, nice.
Yeah.
So it opens up other opportunities.
Yes.
Man, that's good. I like, and all that from starting, you got your LPN.
Yep. RPN in Canada.
RPN in Canada. LPN here.
LPN here, yeah.
And now you're not really doing nursing. You're doing more
administrative. Yeah. Reporting.
Interesting.
Yeah.
That's an interesting career path.
Right. Right. And now my next goal is to start I'm going back to college in the fall.
Oh, nice.
Yeah, I want to do health informatics, health IT, because I've really, really liked doing that.
Yeah.
Through all the things that I've really learned by working in the health center. So that's exciting. And as the world is transitioning, to AI and who knows that and beyond, I think it's a good opportunity to, learn that and see where it goes.
Yeah, I heard a story that this little boy was having health issues, several doctor visits, couldn't figure it out. They put it into an AI model, his symptoms, and it diagnosed him.
Wow.
And it was correct. And they were able to help him.
Right?
It's incredible what I can. Because it just learns and it has access to information just much faster than what we can process. And so it just, whatever it scoured or whatever information it came across, it was able to diagnose him.
That's crazy.
It was pretty incredible.
Wow.
That's very cool. So how long is your schooling going to be? Is it a master's? Is it a bachelor's?
I think we'll start with a bachelor's.
Okay.
And see where that
goes. A bachelor's in what again?
Or it might be, I don't know if it's an associate. I think it's either going to be a 2 or 4-year degree, health informatics.
Health informatics?
Informatics,
I've never heard of that. Well, that's one of the reasons I started this channel, because my daughter was, as she is looking for a career, I'm like, man, there's a lot of things I don't know that are out there, that are possibilities that, that she could pursue and or be good at.
Right.
And so, so now whenever you get your degree and you start working in health informatics, you can come back and talk about that.
How that's going, right? Yeah. I always tell people, healthcare is not, you think of healthcare and you think nursing.
Yeah.
You think like patient care.
Yeah.
But it is so not just that.
Yeah.
Like you could get a job if you like computers, if you like technology, there's a place in healthcare for you.
Yeah.
If you like culinary, there's a place in healthcare for like it's just it's so broad, right?
Yeah.
But it's all about what you can do in the industry to help people.
Yeah.
Yeah. So maybe, I don't know, you like the arts. There's a place in healthcare for it. Yeah.
Wow.
Yeah.
Very cool.
So I tried to tell my daughter, she's like, I'm not going to be a healthcare mom. I'm like, but there's even marketing, because she likes marketing. I'm like, you have a place. Right now we have a very strong marketing department.
Oh, yeah.
Yeah.
Cool.
So,
Wow. And so obviously, as you said, it was an unexpected career path. And so and you talked a little bit about pros and cons of working from home. Is one of the reasons you're moving up, it's to pursue something that you liked? Are you going to have to not work from home, or can you still work from home? Is that any consideration? I know a lot of people they like that they can work from home.
Right.
In fact, I have a friend that they were going to make them go back to the office. And so there's like, I'm going to look for another job, because they're like, I want to work from home. Like that just became, and again, it was through COVID. They became remote, and then he just loved it. And he's like, I'm going to work from home. Like, I don't care like where I work, but I'm going to work from home.
Right.
Is that a factor for you? You're my first guest that works from home.
Wow.
So we're going to talk about that.
Like maybe 6 months down the road, it might change.
Yeah.
But right now, like I like working from home. I really like the flexibility and with my job, when I first moved, I was wondering like, how is this, going to work out? But my supervisor had a lot of like trust, because, if you work from home, you have to obviously have like integrity and, all those things. So, so working from home, I like doing it. And I can kind of manage my day really well. I actually work more working from home than because when you're in the office, you get stopped, right? You're talking and all these kinds of things. When you're working from home, there's like just you saying your work. You just got to do it. And so then it's like, okay, I don't, clock in or out, right? So I'm like kind of salaried. So you just work. And then you're like, I did 10 hours today. Oh, I did,
Wow.
it is. Yeah. So I like that, but I'm a people like facing, I like interaction.
Okay.
And so I don't think I would do work from home like permanently.
Okay.
Yeah. Maybe even a hybrid would probably be a thing, but I definitely think a part of what I'll be doing in the future will be some either with clients or in Yeah.
Okay. Yeah, I'm like that. My wife works from home. I need to go out.
Yeah.
I need to go out. I need to, even when I work on my business here, I don't feel as accomplished. It's kind of weird. But yeah, I need to get out. I need to do stuff. I need to be active.
Yep.
I need to talk to people.
Yeah.
I need to be social, and I need to be active.
Yeah.
That's my thing. I can't do jobs that are not social and not active, which isn't for everybody.
It's true. And I miss the team parties and the luncheons and the free pizza. Because we always have little incentives if we have 10% no shows this month, you get a pizza party.
Oh, nice.
And I love to see it in the daily updates. Can I get a pizza? So
you're really far from everyone.
Yeah, I am. And we have company parties, our summertime and the year end and all.
Do you ever have to go to Pennsylvania for work?
Yes. So which is good actually. So every October in Pennsylvania, there is an association, Pennsylvania Association of Community Health Centers.
Okay.
There's an annual conference.
Oh, nice.
It's a 3-day conference. So I've been back, I think, every year since I've been there. And then we're also a part of different networks, health center networks and stuff. And they usually have conferences or 2-day summits, those types of things. So I've been back up for a couple of those. And whenever we go up, we still have family in PA. Yeah. So if we go back up, then I'll go in the office, get to interact that way. So that's pretty cool.
That is cool.
Yeah.
Very cool. And they fly you up there?
Yes.
That's good.
Yes. No, because last time for Thanksgiving, we drove up.
Yeah.
And it's not, it's a long drive. Yeah. It's a long drive.
Yeah. I'm not a good driver.
Yeah.
I one time, I'll tell you a quick story. It's kind of embarrassing. We drove to visit my sister-in-law in Conroe, which is 3-4 hour drive.
Yeah, that's...
Before we even got there, I was falling asleep. In fact, we got to when you're about to get to Conroe, you're driving through these little towns. And so we're getting to a light and I'm dozing off. I'm already braking, thankfully. So I'm almost stopped. Well, I end up hitting the car in front of us. It was a tap,
a little tap.
Boop,
okay.
Little tap. He got out. I was I'm so sorry. And my wife and I switched. She drove the last 40 minutes, whatever. We were almost there. It was literally 30 minutes away from my sister-in-law's house.
So you're sleepy?
And I was sleepy. I cannot drive
Wait,
long
was this
distances.
in the day or at night?
It was right during the day. It was
the sun was
afternoon.
out.
Yeah, it wasn't even late at night. It was we left here in the morning. We got there 12 in the afternoon.
Wow. Okay.
So I'm a terrible, and I'm an even worse. What do they call it? Co-pilot. Because I fall asleep.
Oh, you're just gone.
Out. 20 minutes into the ride, I'm asleep.
It's all yeah.
So whether I'm driving or not driving, I'm falling asleep.
Long distance is not. Okay, got it.
But my wife is a great driver.
Oh, okay. She'll stay up.
She'll drive.
Nice.
She doesn't mind me falling asleep. She'll listen to her podcast.
Right. That's what I do. I listen to my podcast, right? And I just drive.
Yeah.
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 That's cool. Kirk does the same too. He drives far. And podcast, they really pass the time. Because, if a podcast is an hour.
Yeah.
Yeah, it's pretty good.
So okay, you mentioned working from home. What does that look like as far as I know you don't clock in and clock out, but waking up, you have work, and then you have lunch breaks and leaving work and transitioning to okay, now I'm home, right? What does that look like?
Depends on the day.
Okay.
Because sometimes I could start really early. So Pennsylvania, the Northeast is an hour ahead of us. So, and I work on East Coast time.
Yeah.
So what's 9 a.m. there is 8 a.m. here. So my typical day will start at 8.
Okay.
Unless we have an early meeting, which starts 8 a.m. there. So here's going to be 7. So depending on what my calendar tells me, then I'll start. But typically I start at 8 and I'll, get on, signed on and probably I'll check my calendar to see okay, what's my day gonna look like and all those things. My calendar I have it set up there's some tasks and stuff that need to get done, so I'll do that if there's any meetings in between that. My company uses Microsoft Teams, so that's how we communicate back and forth with each other. So I'm in a lot of groups, and there's chats and people requesting help, and the days is pretty going full like that.
Yeah.
I'm not good at separating, like, okay, I need to take a break.
Okay.
Need to have breakfast.
Yeah.
Need to have lunch.
Yeah.
I need to take an afternoon break. I'm
You'll just
really
keep
bad.
going.
Yeah.
Yeah.
And my blood sugar is like, whoop, whoop, whoop.
Yeah.
Like, all right, I gotta get up.
Yeah.
So I'll rush quick, like grab something, make something and take it back to my desk. It's bad. It's bad. So that's something I have to work on.
Yeah.
I want to work on because it's very important. And I have a sit to stand desk.
Oh,
so
nice.
I'm supposed to every hour I'm supposed to get up and I don't. It's bad.
Yeah.
It's bad. But I need to do that. It's very important, especially working from home, sitting at a computer.
Yeah.
That you have those breaks.
Yeah.
My company allows a 10-minute break.
Yeah.
And then your lunch.
Yeah.
And then in the afternoon. So that's something that I'm working on to really cut away from that. And then at the end of the day, my day will probably end. I try to do it 8.5 hour, depending. It's heaviest for me in the week. And then toward the end of the week into Friday, it's a little bit lighter.
Oh, that's good.
Which I really like. So I try to, front load a lot of things. So I might work a 10-hour day, couple days earlier on. And then, and then I try to be off by 5 p.m. East Coast, which is 6 p.m., which is 5 p.m. here.
Yeah.
And then by Friday, by 4, I'm kind of done, or a little bit before that.
Yeah.
Yeah.
Cool.
So that's what the days look like.
That's a good. That's an important life lesson to have boundaries, right? Because it was the same thing when I was a teacher. It's the same thing. Now that I'm a business owner, it's the same thing. I can come home and I'm like, I need to work on the business, right? There's a lot to be done, right? When I was teaching, I'm like, there's things that maybe need to be graded or things I need to prepare for tomorrow. And it's like, at what point is enough, right? And so I think I heard squats were good. Like every 45 minutes to an hour, you get up and you do squats. And it replaces like so much walking or something. Okay. Look it up.
Squats
are good. I did, in fact, when I was a teacher, I found on YouTube a 7-minute exercise, and I would do it. I would do it in the morning. I would do it because in the mornings I would have my conference period, right? And then I would either do it lunch or after school. I do like that little 7-minute exercise thing.
That's cool.
It's pretty cool. Yeah. I was doing it in my class. I'll just lock my door on my computer. I'm doing my little exercise.
Nice.
And so, okay. So boundaries. Is there anything that you have learned? Anything that you are doing now working from home that you have learned where you're like, hey, this is good? Yeah, as far as either setting boundaries or being able to transition to the home. Right. Is there anything you've changed since you've started?
Yeah, so deciding the boundaries is really important.
Yeah.
Knowing, okay, work time is work time. And being respectful of that.
Yeah.
And then when it's home time, same. Home time's home time, and not mixing the two. When I was home working, in person, that was hard. I was still developing and being in that leadership role. I was just constantly working.
Yeah.
Like I'd work day and night and everything in between. But working remotely, even though I work more, it's not time. It's like I actually use the 8 hours I have to work.
Yeah.
Whereas if I was 8 hours in person, it would be interrupted. You see the difference, right?
Yeah.
So really, organization is really key. Okay. Even though my emails are a disaster, and we won't talk about that. But organizing your day, like my calendar is color coded and all the things, because
Okay.
Like, if it's brown, I know what meeting it is, and it's with a third party person. If it's green, it's with this. If it's whatever, it's internal, that type of thing. So that helps me. I use my calendar like a task. Like it's not, I don't have a separate task list. I have a calendar that tells me 2:00, I'm going to do this task. Right.
Oh, nice.
So So that way that time is blocked. Because if not, people will just drop a meeting in there, and I'm like, I want to do this. So I've tried to have like a separate task list, a to-do list separate from my calendar, and never get to open it, and it gets. So I'm just like, so I really like my calendar looks full, and people are always like, you're always busy, you're never like, and I'm like, okay, there's tasks and there's actual meetings.
Okay,
So if you want to like schedule time with me, it might be doable because it might be a task that I can push, so I rather be in control of that time rather than leaving it open for somebody to, automatically do it. Yeah. So those two things of that work-life balance and being organized are like really important and something I've developed. I think as I've worked remotely. Yeah, because when I was in person, I mean, you go into work, you do the things, but it's just different. It's a different, the atmosphere. It's just, I don't know.
Yeah. Working from home, like you said, it's by yourself. You are in charge of yourself, pretty much. You have, even though you have, a boss and you have projects or whatever. You have a lot of autonomy as far as like when and how long you're going to do these things.
Right.
And so, organization would be, I do the same color coding thing with my personal calendar. I do, so my stuff is blue and then the family stuff is orange and then our kids' soccer, because their club team is red. So all the soccer stuff is red. And so, same thing.
That
color
helps,
coding
right?
helps a lot. Yeah. And then my wife is super organized. We have our family calendar on the wall.
Yes, I love that.
I have my personal calendar that I do everything. I have a Google calendar where I input, because we'll talk. I input stuff in the Google calendar, and then mostly just like the color coding thing. But then I'm old school, pen and paper.
Oh, you're
I have to. So like when I wake up, I'm like, I look at my calendar. Like I look at my stuff. And then if I need to know Josette or the family stuff, I go to Google and look at all the colors. And so, so were you, okay, let's go back a little bit. You got your certification. How did you, because you got a job in Canada, and then was it the same job in Pennsylvania or no?
Let's see. So in Canada, I was working as an agency, which means I was going home to home, like I had clients that I was taking care of.
Okay.
And then when I moved, we got married and I moved. I didn't work that first, like a couple of years.
Yeah.
Then when I started working, again, it was like with a couple clients. It was like just friends that I knew I was taking care of, like their mom, their parents.
Yeah.
And then when I got my first like job here, it was at a home care agency as the office manager.
Okay.
So again, that wasn't hands-on nursing. That was I was doing payroll. I was hiring, like firing. People.
Oh, firing people.
Yeah.
So you fired people. How's
hired
that?
and fired. Yes.
How is? Let's talk about that for a little bit. How is? Because hiring is also difficult because you're getting this. You're getting this person that is going to present themselves well, but then you're like, you have to make that determination of are they really who they're saying they are?
Yeah. That's one of the areas that I don't like is supervising. I just don't.
Yeah.
And my husband's always like, you're a supervisor. You're gonna be like you're. And I'm like, I'm the very like the guy in the back, like doing the thing without being seen and having, being over people. I like to be over systems, like not necessarily people. So in the hiring and the firing, I don't like it. No, I don't like it. So it wasn't my strongest skill, I would say.
Yeah.
But then from there, my next job was in a skilled nursing facility for a few months, and then in a nursing home, and then this job that I'm doing right now, in this company. So when I started this company 13 years ago, I was hired as the supervisor for the adult medical assistants. Okay. So our health center at that time was pediatrics, medical, and dental. Mm-hmm. So I was over the adult population. Okay. And here I was back in supervising, right? Yeah. Hiring and firing. And I'll tell you, I had a medical assistant. I was new to the world. I was new to the health center world and all the things. Yeah. And this medical assistant was probably one of the most difficult people I've ever met in my life. Yeah. This person was just really difficult to get along with, really hard to supervise and, to be a team and all of those things. But we got through it. And eventually, I don't think I fired her, but I think fate had it where she was fired.
Yeah, she was fired.
She was fired. So it was good. But that actual supervising, apart from that experience with that person, I actually really liked it because there was, again, problems to solve. There was scheduling issues that the MAs were butting heads. I want to work. So we, I like that. I got everybody in a room. What do we want to do? I like those kinds of things, right? So I like that. I like that supervising role. Yeah. But then, I think leaving Canada, back to your question, when I came to the US, I think I had 3 different jobs where I did do some patient care bedside. But from the majority of my career, it's been just shifting into this administrative, this other area, Yeah.
Well, so originally what I wanted to ask, and then I'm going to write it down because I'm going to forget. So the first question, what I wanted to ask, and the reason I asked if you worked at different jobs was I wanted to ask the process of how you looked for and how you got the jobs you got, right? Because that's one thing. And then the second question I want to ask, now that you talked about your you hiring and firing, another reason I started this channel is because I want people to know, hey, in this career, every career, like you mentioned, right? I like managing and I like problem solving and I like, right? But if I'm in this position, I'm going to have to hire people. I'm going to have to fire people, right? And so same thing, every career has that. So one reason I didn't become an electrical engineer was because to me, engineering in high school, my brother was already an electrical engineer. And so I just wanted to copy him. But in high school, the way it was presented to me, it was just fun. It was just robotics. We would build robots and we'd go to competitions. And the robot I built in college it had to go through a maze, right? And so it was fun building the robot and programming it to go through this maze. And that's what I thought engineering was. Hey, I'm just going to have fun all day building robots. That's it. And there is maybe I could have found that, right? But then talking to my brother, he's like, no, I sit at a computer and I look at I'm designing chips. And it wasn't like this, you just, you don't, again, in high school, it was me working on my robot and I got to do whatever I got to do what I wanted to do. And this is what I thought engineering was. This is what I want to do. But then in the real world, it's no, it's not all just fun and getting a robot through a maze, right? So there are things at your job where you're like, I like my job,
Right.
but yeah, every job has things that you're going to have to do that you don't want to do.
That is correct.
So let's go back to the first one. How did you get the jobs that you got? What did that look like?
I will say, in healthcare, especially when you have a nursing license, you can walk in to a place and walk out hired.
Really? There's that much demand?
Yeah, there is demand.
Oh.
It's easy. I mean, it's not like you can just walk in and walk out, but it's not difficult.
Okay.
With a nursing license to find a job.
Okay.
In any area where that license is being hired. So like when I got out of school, I think there was recruitment and stuff. It was pretty easy. Like just start, especially like with agencies are kind of low hanging fruit. It gets you kind of wet, in the field. Get to figure out your way. It's not like you're in a facility where, there's people and doctors and chaos. You start out, you just go, house to house. You have some clients, you build that rapport. You know how to take care of people, help them with their daily needs, all those kinds of things. And then that's how you build your experience. So I think I did that out of high school a bit. But then I got married and moved to the US right after that. So then I took a little time off. And then started back again helping, like I said. It was like a family friend thing that I was doing, helping the elderly couple. And then
how would you get paid from that?
I think just like weekly pay, just like
but you were like,
what you call it. Okay. Like, it wasn't like through anybody.
Oh, okay.
Yeah, it was just friend, just doing a thing.
Okay.
Yeah. And so then when I first got hired at the home agency where I was the office manager, I think I just looked in the paper, like our local newspaper.
Okay.
And saw that, they were hiring and applied and did the interview and got hired.
Okay.
And I left that job because I found out I was pregnant. And my bosses, there were two Jewish people at the time. I say that because there's significance there for me, but they were just so amazing.
Yeah.
And I developed a really good relationship with them. They were the owners and then me.
Oh, wow.
And they trusted me with their entire business to run it and to do all things. So I was extremely grateful. So when I got pregnant, I knew I was going to be a stay-at-home mom. At least I wanted to for a little bit.
Yeah.
So that was hard.
Yeah.
To leave that job. But then I left, stayed at home for 2 years, and then we moved to Pennsylvania. Then I found out I was pregnant. So then I got a job, but then I think it was like 6 months. I left that because I gave birth to our daughter.
Yeah.
And I found that job again. I think it was just through either the paper or like online, just looking for, just something.
Yeah.
And then, so I had our daughter, and then I took off, I think, for 6 months to be at home with her. And then that's when I worked nights. And that job, again, it was local. I think it was like either through internet or our local paper. I think it was our local paper looking for healthcare jobs. Boom, found it. And and I did that. I think it was like a year and a half or 2.5 years. I can't remember exactly. And then I wanted to leave that job because that was a nighttime job. And I wanted to go to work during the day. So this job that I have now, I believe I looked on either Indeed or one of those recruiting sites.
Yeah.
And found a job. Did the initial interview over the phone.
Nice.
And I think I told HR I don't work Sabbaths. I don't work Saturday because of my faith. And she hung up, and then she called me back. She's like, "Yeah, you can do it.
We're good."
Yeah.
Oh, wow.
Yeah. So then they called me in for the interview, and
that's good.
Yeah,
that's very cool.
But it's healthcare. It's like if you want a job, whether online or look in the local paper,
There's something out there.
There is something out there. Yeah.
That's good.
Yeah.
That's good to hear. Oh yeah, you mentioned something and I want to ask you. You mentioned that you were working and then you got pregnant and you're like, I'm going to stay home. Okay. One of the best pieces of advice my wife and I got before we got married, a friend of mine told me, he said, live on one income. He said, live off of you're the guy, live off of your income. Because, and he told me this over a private lunch. It was just me and him. He said, because if Josette ever gets pregnant and wants to stay home, she has that option and it won't affect your finances.
Very good advice. Yeah.
And so I don't know if you can speak to that, as a professional working mom that made that choice, right? Because I have a friend who went through the opposite. Him and his wife got married. They were both making good money. They bought a home, assuming, we're going to always have this combined income. She got pregnant and they didn't have that conversation, or they didn't have someone to tell them, hey. So then she wanted to stay at home and he I had to tell her, like, we cannot afford for you to stay at home. Like, we bought this, like, we have set up our life in a way that we both have to work. Like, Yeah. So it took about 3 years to where she could finally stay home. And it was like, they had their kids pretty close. So by the third child, I think she was able to stay home. With their first child, I remember she would say, like, she would drop him off with his mom. She was like, I would cry. She would cry. She'd go to work. She was like, for months, I'm like crying, dropping off my son. And then finally, she was able to stay at home. But I don't know. Can you talk about that? From your side?
Yeah, because when we were living in New Jersey and I wasn't working, and we weren't pregnant at the time, I got the office management job. And at the time, my husband was the only one that was working and we were fine. We were living on that income, doing well. And then I started working. And it's funny, I think it was after the fact that we got that advice. But I remember that advice, like living on the one income. And if you get extra, just bank it. Like, just save it, whatever. But as you were talking about your friend, I thought about the lifestyle.
Yeah.
And the lifestyle you want, can the incomes support that lifestyle?
Yeah.
So we didn't like think it like through, at least to the point where we decided, like, okay, yeah, we're gonna do this. Like, you're just working now. We don't necessarily like need your money.
Yeah.
I think just looking back, hindsight, it would have been like good, to have done that. Yeah. And then even like now, just coming through, it's that advice is so good, because if you can make it work, like even initially, right? Dave Ramsey says, live like anyone else, so that one day you can live and give like no one else. Like, now it's okay, right? Make it that one income fit. And then, scale back on your life, like do whatever you need to do, right? To do it, because I think later on the reward is so great. So I'm totally like 100% endorse that. And hope that, one day we will do that. We can do that, because like even us now, our income situation has changed. Used to be a 2-person income like household, and just temporarily it's one, but you think, we had to scale back and do some things. When it does come back to 2, we can, look at that and really be strategic. But that's great advice. It really is.
Yeah. And it does. I like how you said lifestyle, because because my wife and I did that for so long. Once she started working, we were in not, I don't want to say a better position, but like it, like you said, right? It just expanded um, our options, right? But again, living under my income all these years didn't, like, it forced us to make certain decisions, prioritize certain things. But it's only temporary, right? Or if that's just what it is, like you can, it's easier to start living on one income and live off one income, or start on one income and then become a two income, as opposed to the opposite.
Yes.
Where we're two income and then like for whatever reason, like we lose an income, which happens. Like it's much harder to make that adjustment.
Right.
And so, because I actually want to interview my wife for this. I want to do a stay-at-home mom. Because I can do playlists. I can do playlists on YouTube. I want to do a stay-at-home mom playlist because she stayed at home from when we started having kids until my youngest started going to school. So that was probably like a 10-year where she stayed at home.
Yeah.
I interviewed another. This lady was a teacher, and same thing. When I had kids, I stopped teaching, and then once they grew up, I went back to teaching. And then I have another friend that she was just a stay-at-home mom. She's still a stay-at-home mom. Like she never worked. They just always lived on the husbands. And I was like, so I want to interview all of them, right? Because we career and work, it touches everything, right? It's not just, this channel isn't just about like, hey, this is what I do. Because I can go on the internet, right? And I can look up, okay, to be an LPN, it costs how much? And I need to study this long. And they make, a salary range, right? Okay, I can look that up in 5 minutes. But to have you on and to say, hey, well, this is how I started, but then it got my foot in the door and now I'm doing this, but now I'm interested in this, like that unexpected paths,
Absolutely,
right? Of what, like where life takes you, right? And then you're like, I'm working and I'm like, but I get pregnant. I'm like, I'm going to stay home with my kid because that's my choice. And that's what we want to do. And so then that sparks the conversation of, income and things for people to think about before they even start working, before they have a family, right? Yep. And so it's just very the focus of this channel is work and career, but I don't think you can have that conversation without talking about everything else that comes, all of it. Yeah. So thank you.
True.
Okay, so post-COVID, pre-COVID, how has there been a lot of changes, or has there been, like a lot of changes? Has there been few but important changes? How has that looked?
So I think the COVID pandemic taught us all like a lot.
Yeah.
And our organization, being federally qualified, we definitely shifted, in the direction the winds were going, right? Okay. All the regulatory requirements, all the things we did. Now, post-COVID, things have changed. There's still a level. And in fact, we have a policy that kind of governs us based on the level of threat that we're in, low, medium, or high. Yeah. And so, that's how now the organizations run, right?
Yeah.
Low risk is, right, there's not a lot of things happening. And so it's always there, I think. The health center world, it shifts as the health, the leadership, like CDC and all, kind of shifts and navigates that. Especially we're not a private practice. Okay. We're public, we're federally funded. Our clients are, people that need us, right? Who would otherwise might not have quality healthcare and all those things. So we cater to our community. And so, we have to keep up with the governance, that side of things. So things have, during COVID, there was a lot of like every day there was something like going on that you had to fix. But I think now we're kind of back to sort of pre-pandemic, states of minds and levels, but certainly still having that like, I think it's taught us enough to know that we need to have at least preparedness, right? That game ready. So, yeah. I think, and even down to like how we run the lunchroom, like even now, I think it's still important. Things affect if we have our company holiday party or if there's, certainly things still kind of direct how we move, but for the most part, we're back to business, I think, as usual.
Yeah.
Yeah.
Very cool. Okay. Are there any trends you see shaping the future of healthcare or what you do specifically?
Right. So we did talk about AI a little bit. I've attended a couple webinars focusing on, what healthcare and AI, how these two could connect. And there's already companies that have already taken the lead. And I love that. Organizations that, are already ahead and doing those things, because healthcare is very private. You think about like HIPAA and HIPAA privacy and patient privacy and all of those things. And just the robustness of AI and the intrusiveness of AI, or it could be, right?
Yeah.
But at the same time, AI is so powerful, like you said, for the kid, right? Just dumping something in there and popping out, where it probably, the doctors and all the practitioners probably could have come to the same conclusion, but it would have taken them longer, right? More time and all that. So that's what's happening right now in the healthcare world. And I think AI will transform how doctors deliver care. Right. We use scribes to, when a practitioner does their assessments and all those things to document. But there's AI for that. Yeah. Right. So it's just that side of healthcare, I think, is changing. But at the same time, you can't change it too much, because there's people who still don't even do online banking. Like, they will not touch it. Really? Right? So you tell them, this level of, interaction with a bot, and they're going to be like, there's no way. Yeah. Like, we have patient portals within our organization that we encourage. And encourage patients. Log into your patient portal. You can talk to us through your portal. You can do all the things. And they're like, no, I'm going to call you on the phone, right? Wait 15 minutes to talk to someone. Yeah. So it's navigating through that role, understanding that in healthcare, the population, it's diverse, but healthcare, you think of, older people, sick people. It's not like the young Gen Zs running around. Like, we have a hard time getting them into the office. Right? So it's that. But I think, that's the shift that I see personally in healthcare, and I'm excited to see where it's going to take us.
That's cool. Yeah, as you were talking, I there is a lot of potential, but like that. How do you build in trust to AI? Right. So same thing. I was not too long ago quoting. Every once in a while, I'll go and try to see if I can get better insurance rates. Car insurance, home insurance, right? And I went to a website, and it was just like put in information, and it'll like spit out quotes, and I'm like, I want to talk to a person. Right. So then I go and I find this local agent and I call and they answer and I'm like, okay, like I'm comfortable with. Like, hey, these are the vehicles we have. These are the homes we have. Like, can you give me a quote, right? And then he's like, yeah, I'll email it to you. I'm like, perfect. And then 2, 3, 4 days later, I'm still getting text messages from this like thing that I started.
Oh yeah.
They're like, hey, don't forget to fill out. And I'm like, I don't. And yeah, same thing. I don't distrust technology, but I would rather call and say, hey, can you give me a quote? And like, yeah, all right. That's my preference. And so I can see that. And part of that is that trust, right? Like, I don't want to put all my information into this computer. Like, I don't know, like how legit this is.
Right.
Like, where's my information going? Right. It's like, if I can call you on the phone and it's a little bit more safe, right?
Yeah, it is.
So nothing is completely safe, but like, there's just, I think AI has to consider that. There's people that just aren't going to trust that, right? Even though it does help, it's powerful.
Yeah,
and it's efficient. Yeah. So I can see on your side, it's like, man, like we created this system that is efficient, and we can communicate and we can keep records and we can, but at the same time, it's like I want to talk to a person.
Yep.
Yeah, because I'm the same way. I want to talk to a person.
Absolutely.
So is there any advice you would give to an aspiring nurse, or just someone that wants to do what you do? Like, hey, I want to work from home, or I want to manage people, or I want to be a nurse.
Yeah.
You kind of trickle in the...
I think healthcare is not cookie cutter. It's really my kind of advice to people. There's so much opportunity in healthcare, and you might start in one way, and you go in and you're like, whoa, I actually like this, right? And there's opportunity for that. So I'd always tell people, don't be afraid. Oh, healthcare, I don't want to go, like, that's not what I don't do.
Yeah.
But healthcare is just, it's an umbrella. It really is just like a house with all kinds of rooms.
Yeah.
And I'd say for anybody, whatever your like passion, whatever you're good at, if I were to sell healthcare, I'm like, there's a place for it in the industry. Yeah. Yeah. And it's you just got to look and find it, because, it's hard for, like, say even marketing, right? I think that industry is very competitive. Yeah. Right. And if you look kind of traditionally for marketing jobs, right? The competition, so like there's a lot of people. Whereas if you think outside the box and you think in healthcare, there's, hospitals need marketing, right? Yeah. Different doctors' offices need marketing, different, things. Yeah. So, just if you're, not, and you don't have to necessarily even, I'd say, like, get a nursing degree in order to do that. Certainly it helps. Having like a nursing degree or a license already puts you on that path. Yeah. Like, it gives you some clout. So I'd say don't shy away from it just because of the stigma. I don't know, just, you think healthcare, you think I have to take care of patients. I have to, there's much more to healthcare than and I've proven that over the last like 30 years, 24 years. Wow. Yeah. Yeah. Very
cool. Yeah, and you're gonna keep going. I'm gonna have you back. I already forget the word you said. Health
informatics.
Yeah. Informatics. I have never heard that word. Informatics.
Health informatics.
I've heard information. Informatics. That's funny. Okay, I have 2 questions that I end with. I don't prepare my guests for these questions.
Okay.
So the first question is, how do you define success right now?
Success, I'm assuming in the career path or
Just
in
success,
life.
just
In life,
career, life,
right?
however
Success
you
to
want to
me
define it.
is like, so my husband at one point said peace isn't just like, oh, I have peace.
Yeah.
Like it's not the absence of war.
Okay.
Peace is wholeness. Peace is like not just peace in like your finances.
Yeah.
But then your parenting or you're falling apart.
Okay.
Peace is like all the things
threaded throughout your life.
Yeah. I think success is the same way.
Okay.
Like I could feel accomplished, right? And like I'm doing the thing that I want to do, that I have a passion to do in my career, that I think is giving back to society. It's like what, not just what satiates or pleases me, but what people, it's like helping people. It's like, it's a service that people like.
Yeah.
So that could be success. But then if your life is falling apart in the other, at home, it's not success.
Yeah.
So I think success is managing, or at least being aware of all of the areas of your life.
Yeah.
And like being a good steward of that. Like, are you good in your career? That's great.
Yeah.
How's your home life? How's your marriage? How are your kids? How are you in your community? Like all the things.
Yeah.
I think to me that determines success.
Yeah.
When all of that's kind of symbiotically working together and balanced. So not one thing and the other thing's lagging. But yeah.
Like
that's how I would think of success.
Yeah, that's good. That's a good definition. The second one, you kind of answered it at the beginning, but so I'll ask you too. What was told to you as far as career and work, and then what are you now telling your kids? So first, what was told to you, and then what is the message to your kids about career and work?
So I think I said at the beginning, I don't recall having a conversation about like my future or career with my mom. That's just not something that was discussed in our household.
Yeah.
You better get out and work. You better contribute to the household.
Yeah.
Whatever that looks like. But there was no real guidance there. So I just kind of landed in the place I'm in, and through experience have really, I think I'm figuring it out. Even now at this late stage, which is another thing. It doesn't matter, like, you want to go ahead, start if you can when you're younger, but it's never too late.
Yeah.
And then what was the second part?
So now what is the message to your kids? What are you telling them about career and work?
So it's pretty exciting because like even in my family, like our immediate family, my husband has his master's degree. He's a chemical engineer. And so you just, even from there, like our children didn't stand a chance. Like you're going to go to school and they're going to, so you're going to figure it out. Right. So they're always encouraged to, really go through and see what path that you're on. Like, what is it that you want to do? And pursue that. Higher education is important, so to do that. And for me, telling them, like, do what you like to do, right? Like, don't just look at the figure, like the dollars. Like, you're going to want to do something that you enjoy doing, or else you're going to hate it. No matter how much money you're making, right? And now I think the world, there's all like what you're doing, podcast. Like there's opportunity to do like what you want to do, kind of non-conventionally. Like it doesn't have to be like, the standard way to do. You can whatever it is you want to do, figure out a way to do it. Be the entrepreneur, right? And but enjoy it. And do well. I think where my husband and I differ, like he's definitely like, go higher education, get your degree and all of that. And I, if that's what you want to do, absolutely, we'll support you, do whatever you need to do. I don't think that path is for everyone. And in a world where there are many different avenues to to where you want to go. And like I said, with success, it's not like climbing that corporate ladder, in my opinion.
Yeah.
Success is really that balance
Yeah.
throughout all of the areas. So if you're in a job, what if I make $60,000 a year, but I'm loving what I do and that's what I want to do, and the lifestyle, we talked about that, it suits, then I consider you pretty successful, right? Like, it's not defined by like you need 6 figures and all these things. So
yeah, I like that. Very cool. Awesome. Well, your kids are gonna be fine. I know you and your husband. Yeah. Well, that's another thing I'm learning with all the interviews is like adults with careers. Like if we look back, it wasn't just this straight shot.
Right.
It was like they had questions like, what am I going to do? And they had to figure it out.
Right.
And eventually, like there are common themes of hard work and building relationships and, trying things and learning none of it was easy. None of it was just like, oh, everything just fell in my lap and I didn't have to work hard and I didn't have to build relationships. It's always the thread is they worked hard, right? They pursued, education, whether it's, a degree or a skill, they pursued adding like a skill to themselves. And then through relationship and opportunity, they are where they are. Right. But again, like there was someone there seeing them struggle through the what am I going to do and where am I going to go and what am I going to study and what do I want, what am I good at? Right. All those questions are real, they're real. Right. And then at the end, you see like a successful adult and you just assume like, oh, they had it figured out from the beginning. And it's like, no, not really.
Straight line.
Yeah. I told my neighbor, he's a teenager. I was like, yeah, I almost got kicked out of college. Like I almost failed out of college. Right. Yeah. I almost got on, I was put on academic probation. And basically it was like, next semester, if your grades aren't, this, like we're going to kick you out. He was like, are you serious? And I'm like, yeah, unfortunately. So I was like, so I told him, I was like, so there's hope for you. Because he hates school. He hates school. And I'm like, I didn't like school, but I was like, I told him you need a girlfriend. That's what motivated me. I was like, if I want to get married and
awesome.
I need to apply myself. And so that was Josette is the reason I got all A's and B's after.
Look at that.
After I almost dropped out.
That's awesome.
But it took forever to get my GPA up because my GPA was bad. It was like a 1 point something. Yeah. And then, it was a slow climb.
But you did it.
It took years
hard work,
to get
you did
it.
Yeah, that's awesome.
Yeah.
Nice.
All right. Well, thank you so much.
You're very welcome. Thank you for having me on. Yeah, that was good.
It's going to help somebody. So it's going to influence someone to do nursing.
Yeah.
Or
it's very non-conventional. This is, it's like, wait, what?
Yeah. No, that's cool though. I interviewed a principal who now does leadership consulting. But the funny thing is when she found leadership consulting, she was like, man, like everything I did in my life prepared me for this. Right. She's like, I worked at a school where there was like bomb threats and there was like fighting and there was drugs and gang, and she's like, and I was like, oh, like stressed out. But now, like having gone through that, now I'm a leadership consultant and there is nothing that, these people can say that I haven't like dealt with.
Yeah. Yeah.
And I was like, man, that's powerful.
Yeah.
That's really cool. Cause now she's going to be able to help a lot of people. Cause she went through the, answering the bomb threats and like stopping the fights and finding the drugs and now she can help people. And so same thing, right? Like, people think when they start work, like I'm going to do this for the rest of their life. And like you said, you don't have to now. Now you can do it like me. I was a teacher. and then an inspector, and now I want to do YouTube.
Right.
So who knows what I'll do next?
Yeah. Just fly with the wind.
Yeah. So thank you so much for coming on. Thank you guys for tuning into My Line of Work. I hope today's video inspired you to find the work you love. If there is a career you're curious about, drop it in the comments. We'd love to feature it. Hasta la próxima. That's it.